This meeting is now being recorded.
Hi, everyone. Thank you for joining us for the Lunch and Learn webinar. I'm your host, Donna Karras. Today's webinar is Chlamydia Awareness with Dr. Claire Philippe. She is a family medicine physician at Westfields Hospital and Clinic. Two things you need to know before we get started. First, I am recording the webinar, so if you have to leave early, don't worry. I will send out the recording to everyone later this week. And second, look at the top of your screen for the Q&A tab. You can click on that and enter a question at any time during the webinar. We will watch for any questions to pop up so that Dr. Philippe can address those. Now let me turn this over to Dr. Philippe.
Hello, everyone. Like I said, I'm Dr. Philippe, and I work at Westfields Hospital and Clinic. And today I'm going to be talking to you about chlamydia. The title of my presentation is Chlamydia, the Silent Infection, and we'll talk a little bit more about why it's called the silent infection. So, to start off with, what is chlamydia? Well, chlamydia is not a flower. It may have a pretty name that sounds kind of like a flower, but chlamydia is not a flower. So, what actually is chlamydia? Chlamydia is a sexually transmitted disease, and it's caused by the bacteria Chlamydia trachomatis. Over in the picture there, you can see a microscope image of what the bacteria actually looks like up close and personal. So what this bacteria causes are different kinds of infections in both men and women. And in women, it causes a cervicitis, which is inflammation of the cervix. And then in both men and women, it can cause a urethritis, or inflammation of the urethra, and a proctitis, or inflammation of the rectum. And chlamydia infections in women can actually lead to serious consequences in the future. It can cause something called pelvic inflammatory disease, often shortened to PID, or tubal factor infertility, even ectopic, or like a tubal pregnancy. And it can also cause chronic pelvic pain. And we'll talk a little bit more later about some of these serious consequences and go a little bit more in depth about those. So how common is chlamydia? Chlamydia is actually the most common sexually transmitted infection in the United States, with 1,526,658 cases that were reported in the United States in 2015. And the counts are actually increasing with chlamydia. Cases have increased over the last 2 years. It's continuing to spread. Chlamydia is actually most common among young people, and it's nearly 2/3 of new chlamydia infections occur in people aged 15 to 24 years old. And 1 in 20 sexually active young women aged 14 to 24 years has chlamydia. It is also more common in blacks, disproportionately more commonly found in blacks, with nearly 6 times more prevalent among blacks than whites. If we take a look at the map over here, it's a little bit hard to see the numbers, but we can see for Minnesota that the rates of chlamydia were about 389 in 100,000. And in Wisconsin, it was a rate of 424 in 100,000. These rates are actually a little bit lower than the U.S. rate of 475.3 in 100,000. All right, so how do people get chlamydia? Chlamydia is transmitted through vaginal, anal, or oral sex with someone who has chlamydia. And a little known fact is that ejaculation does not have to occur to transmit the infection. Chlamydia can also be spread from a mother to her baby during childbirth, and this can cause other kinds of infections for the baby. One type of infection is a type of conjunctivitis, or ophthalmia neonatorum. It can also cause a chlamydia pneumonia in the baby. Even after treatment, people who have had chlamydia may get reinfected if they have sexual contact with another infected partner. So it's not like chickenpox where you can't get it again. With chlamydia, you can get reinfected even if you've been infected before. Now, who is at risk for chlamydia? Any sexually active person can be infected with chlamydia. You're at higher risk if you don't use any condoms, if you have multiple sexual partners, if you're a teen or young woman, and this is due to the type of cervical cells that are on the outside of the cervix. The cells that are usually more on the inside are a little bit more present on the outside, and this actually increases susceptibility to chlamydia infection. The other group that is at higher risk is men who have sex with men, and this is because it can be transmitted by oral or anal sex. So, what are the symptoms of chlamydia? Most infected people actually have no symptoms. This is why it's called the silent infection. And if they do show up, the symptoms may not appear until weeks after exposure. What are the symptoms of chlamydia for women? So if women do get symptoms, which only about 5 to 30% of women do, they can have a few different types of symptoms depending on where the infection is. If they have a cervicitis or that inflammation of the cervix, they can have vaginal discharge, bleeding of the cervix, or they may have tenderness when the cervix is moved, either on physical exam or during sexual intercourse. If they have a urethritis from the chlamydia, they may see pus in the urine, may have pain with urination or urinary frequency, similar to a urinary tract infection. The other thing that women can get from chlamydia is pelvic inflammatory disease, and this can cause symptoms with pelvic or lower abdominal pain, or tenderness on exam of the uterus, or tenderness by the ovaries. What are the symptoms of chlamydia for men? And only about 10% of men actually have symptoms. They often have a urethritis, or the inflammation of the urethra, and this they'll see thick or watery discharge coming from the penis. They may have pain with urination or some type of itching at the urethral opening. They can also get a different kind of infection called epididimitis, which is inflammation of the epididymis. In the picture you can see it's kind of this white thing that's kind of on top and behind the testes. It can get inflamed and cause testicular pain just on one side, and it can cause tenderness when it's touched and even swelling. So in the picture you can see that the epididymis is kind of red and swollen, and it causes pain there around the testes. So what are symptoms of chlamydia that both men and women can get? And both men and women can get a proctitis or a chlamydial conjunctivitis or even pharyngitis. And the symptoms are similar for both men and women. So a proctitis may cause rectal pain, rectal discharge, or rectal bleeding. With the conjunctivitis, which could be from contact with infected secretions, it would be similar to a pink eye with eye redness and eye discharge. Pharyngitis or sore throat could happen, although this is really quite rare. There's usually no symptoms of chlamydia infection in the throat. So what complications can result from chlamydial infection? So we talked a little bit at first about some of these complications, and one is this pelvic inflammatory disease. So the infection can cause infection of the uterus or fallopian tubes, and then this leads to inflammation that can cause scarring and permanent damage, leading to further problems like chronic pelvic pain or infertility from scarred or closed fallopian tubes, where the inflammation kind of scars the tube up, and then the sperm can't get to the egg, causing infertility. Or there could be an ectopic or tubal pregnancy, where that scarring of the tube can actually prevent the fertilized egg from coming down into the uterus and implanting there. And if it does start to grow in the tube, there's not a lot of room for it to grow, and it can be life-threatening to the mother. The other thing that pelvic inflammatory disease can do is cause some inflammation of the liver capsule, and this can lead to pain that's more in the right side on the upper quadrant. Another complication that could happen is a reactive arthritis, causing pain in the joints, and this used to be called Reiter syndrome, and when it was associated with the urethritis and the conjunctivitis and the pain in the joints. Now, how does chlamydia affect a pregnant woman and baby? In pregnant women, chlamydia can cause a few complications. One is that it can cause preterm delivery, and then, as we talked about before, it can cause a conjunctivitis or kind of a pink eye in the baby called ophthalmia neonatorum, or it can cause a chlamydia pneumonia in the newborn. Because of these risks, we try to prevent the spread of infection to the newborn and treat patients so that it's not spread to the baby or causes preterm delivery. So we screen and then treat chlamydia infection in all pregnant women. And all pregnant women are screened for chlamydia at their first prenatal visit. If the pregnant woman is under 25 and those with new or more than one sex partner, they're screened again in their third trimester. And then pregnant women with chlamydial infections are retested at 3 weeks after the treatment and then 3 months after being treated. Chlamydia, not knowing, spreads it, so get tested. There's some advertising going on with public health to try to get people tested, and this is because the majority of people with chlamydia have no symptoms, and so testing is recommended for sexually active teens and adults. So who should be tested for chlamydia? Anyone with symptoms like vaginal discharge or discharge from the penis, or burning during urination, unusual genital sores, or if they have a genital rash. Anyone with oral, anal, or vaginal sex partners that have been diagnosed with an STD should also be tested. Screening tests are recommended for a number of different groups of people. It's recommended for all sexually active women younger than 25, and they should have this done yearly. If a woman is over 25 and they have risk factors, such as new or multiple partners, or they have a sex partner who has a sexually transmitted infection, then they should be screened yearly as well. If a woman is diagnosed with chlamydial infection, then she should be retested approximately 3 months after being treated. Annual screenings are actually not recommended for men. And other people who should be screened are sexually active men who have sex with men. They should be screened for both urethral chlamydial infections and rectal infections at least annually. Screening for pharyngeal infections is not recommended for the sore throats. Men who have sex with men with HIV may need to be screened more frequently, as frequently as every 3 months. People with HIV should also be screened yearly for chlamydial infections. So how is chlamydia diagnosed? There are multiple ways that we can test for chlamydia. We actually use vaginal swabs, and this is the best way to test for genital chlamydia in women. Now we even let patients collect them themselves if they would prefer, or traditionally it's been done by a provider while doing a pelvic exam. There's also urine collection, and this is the best way to test in men. It can also be used in women. It's favored for men now. We used to do swabs in the penis, and now we can avoid that by using the urine collection. You can do swabs in the throat to look for infection there, or in the rectum to look for the proctitis. And what is the treatment for chlamydia? So chlamydia is cured with antibiotics, although the antibiotics cannot repair permanent damage caused by the disease. To prevent spreading the infection, people with chlamydia should abstain from sexual activity for 7 days if they have a single dose of antibiotics, or until completion of a 7-day course of antibiotics. And all of the medication should be taken to finish the complete treatment. Women and men should be retested about 3 months after treatment of an initial infection to check for any kind of reinfection. And the type of antibiotics that we use kind of depend on the patient and their allergies. It also depends on the bacterial resistance in the area. Often we use an antibiotic called azithromycin, and this one is a single dose that can be used. Another more common antibiotic that we use is called doxycycline, and that one is the 7-day course. Do past partners need treatment? Well, if a person has been diagnosed and then treated for chlamydia, they need to tell all recent anal, vaginal, or sex partners, or oral sex partners. They should tell all sex partners that they've had within 60 days before the onset of symptoms or diagnosis. And then the partner needs to be treated as well. What is expedited partner therapy? Well, the expedited partner therapy, or EPT, is something that some states have where the providers can give extra medicine or prescriptions for the partners of the patient who actually came to the clinic that day. And studies have shown that this actually prevents recurrent infections in the patient, and more of the partners get treated this way. Both Minnesota and Wisconsin allow EPT. And how can chlamydia be prevented? There are a few ways to do that. One is to use latex male condoms, and they must be used consistently and correctly to be effective to prevent chlamydia. Another way would be to abstain from vaginal, anal, and oral sex. And a third way would be to stay in a long-term, mutually monogamous relationship with a partner who has been tested and is known to be uninfected. If you want a little bit more information, the CDC has a lot of good resources, and also the American Sexual Health Association also has some good resources. You can go to their website or give them a call as well. And these are some of the resources that I used for this presentation. And I guess we will open it up for questions now.
Hi, for those who have joined us late, there is a Q&A tab at the top of your screen. If you have any questions, you can type that in and Dr. Philippe will answer those. I'll give you a minute to do that, and I have a question for Dr. Philippe. Who usually initiates the screening? Is it for a woman, is it the gynecologist or at a family medicine annual appointment? That's my question.
Yeah, at a routine checkup, then most women should be screened for chlamydia. That should be part of their annual visit whether they see a family medicine doctor or an obstetrician or gynecologist.
Okay, we'll give you another minute to ask questions. And I had another slide here about the next webinar. It's on ringing in the ears, managing tinnitus with Dr. Christy Albers. She's an audiologist. And that's going to be on July 19th. And let's see, before we go, if we don't have questions, I want to thank you all for joining us and thank Dr. Philippe for doing this presentation. Haven't seen any. Oh, here we go. We have a question.
So the first question is, what is the prevalence of chlamydia you are observing and how is it trending? So we have some statistics from both Minnesota and Wisconsin, and so we are seeing rates of about 400 in 100,000, and it seems to be increasing. It's increased over the last couple of years in both states and nationwide. It continues to be on the rise. In our clinic, I don't know exactly what the prevalence of chlamydia is. I don't have that data, but the chlamydia rates do continue to rise throughout the country and within both of the states.
Well, I think we've given you a chance to ask any other questions. So I want to say thank you. Thank you for joining us, and we'll close off now.